Is nursing a science? It's an odd question, but the answer has broad implications, particularly here at Ryerson, where the university's categorization of its nursing programs is a point of contention for some students. Hi, I'm Michael Delamonte, and welcome to The Ear Opener, the radio broadcast and podcast bringing you behind the scenes on stories reported by Ryerson University's independent student newspaper, The Eye Opener. Science, technology, engineering, and mathematics, or simply STEM, is an oft-used acronym used to describe certain jobs, industries, and academic programs. For example, computer science is a STEM program, so are MD programs. Nursing, however, is not. Despite requiring students to learn about anatomy, diseases, and genetics, at Ryerson, nursing is part of the Faculty of Community Service, not science. Eye Opener reporter Kosalan Kathiramalanathan spoke to Ryerson nursing students who don't agree with the university's classification, believing that nursing should actually be seen as a STEM degree. Kosalan joins me today to discuss why nursing is a part of STEM, why it currently isn't at the university, and the biases attached to the debate. Welcome, Kosalan.
Good to be here.
So first things first, maybe we should just start with STEM. What is STEM exactly, and how is it used in a university context?
Right. You'd think the answer is pretty simple, but turns out it's not. I've looked at different sources, different government sources, and I got different answers from each one. For example, here in Canada, at least, when I checked on Stats Canada to see what programs are considered STEM, their definition was just any program that deals with science, technology, engineering, and math. Places like the United States, they also have a little bit of conflict on what STEM exactly is. Certain governmental bodies, some of them do recognize nursing as a STEM-related field, while some of them don't consider it at all. So it's really hard to define because there is no universal definition of what consists of STEM.
So there's no real guideline to say this is a STEM program and this isn't.
Right. It's more of like what that specific body thinks STEM is, then they'll include it.
Okay, and how come that hasn't happened for nursing? Why hasn't nursing decided to see itself as STEM, and then thus it is?
Well, there's a few different issues to that. One of them is this idea that nursing is a care-based job, where the nurses, their main role is to care for patients, whereas a doctor, they diagnose, they treat, they provide the cure. But a lot of nurses I've talked to have kind of busted that. They've claimed that's more of a myth than anything.
Okay, and to bring it back to Ryerson, what programs are offered in terms of nursing, and what science is actually a part of them to warrant a STEM-related indication?
So one big thing is that the nursing program here is separated. There's the four-year nursing program, which Ryerson just gives out, and that allows you to become a registered nurse. If you were to go to a college, for example, depending on the college you go to, you might just end up getting the diploma, which it won't let you be a registered nurse. It'll let you be a registered nurse practitioner, which is slightly different.
Okay, so if I'm understanding this correctly, at the college level, you can become a registered practicing nurse.
Yeah.
And at the university level, you can become a registered nurse, which is what Ryerson offers.
Yeah.
And when it comes to Ryerson's nursing programs, what do they have in them, and do they have enough science in them to warrant a STEM classification?
Well, according to the nurses I've talked to, they definitely believe so. The stuff that they have to learn so far definitely validates that. An example that one of my interviews gave me, other than the basic anatomy and physiology that they have to learn, they learn really specific stuff. So they learn pathological process of diseases, so how diseases spread. They learn genetics. They learn biology. They also help with the research side of things. They learn how to do quantitative and qualitative research, which they use to assist the doctors with. So a lot of them said that you can't actually care for patients without understanding this stuff.
It seems like this classification of nursing as part of a community service does have some, there might be some biases attached to it. But why do students care specifically? Do they really want nursing to be seen as a STEM field?
Yeah, a majority of them do. Even people out of nursing. I've talked to a lot of engineers on this topic, a lot of computer scientists as well I was just interviewing. A lot of them agree that the scope of what nursing does warrants that STEM title. And it's a matter of just being recognized for the work they do.
And the degree that they earn does not even have science in the title?
No, it does actually.
Okay.
So they end up, that's another point of contention. They're in the community or the Faculty of Community Service, but they end up getting a Bachelor of Science, which kind of muddles it even more.
Yeah, it seems like there's a disconnect there.
Yeah.
Kind of counterintuitive.
Yeah, it really does. And a lot of the students I talked to also agreed with that. They said that it doesn't really make sense that they are earning a Bachelor's of Science, but some people will exclude them from the STEM designation.
And what is the history behind nursing being a part of the faculty community service? Why isn't it even in that department originally?
Some of the nurses I did speak to, they mentioned how a gender bias may have come into this play. And I actually talked to a registered nurse who works at a hospital, and she's also a clinical instructor here at Ryerson. So she helps grade the clinicals that these students have to go through. And she made the point that she feels like because nursing is there's a lot of women in it, she feels like because of that, it kind of makes it seem like the work that they do isn't hard. So it's kind of like the misogyny behind it. Some people believe if a woman can do it, then anybody can do it. So that's one reason she believes that sometimes they're not seriously considered in the STEM field.
And yeah, can you provide some examples of that? Because I think the maybe old school societal conception of a nurse is like the doctor's underling,
right,
or someone who like clears bedpans.
Mm-hmm.
What are some of the occupations that individuals with a nursing degree are doing that are far more scientific related?
Right. So like I mentioned, some nursing students have mentioned how they want to get into more of the research side of things. They do help conduct some of these research activities into various things that can go anywhere from diseases to just how people react to certain things. And including some people that I personally know have expressed interest in going to the emergency medical field. So a lot of people have showed interest in going into paramedicine, which once again, like that's more of a care-based thing, but it's also very heavily rooted in science.
Okay, so there is a kind of like subfield of research that nurses can go into.
Right.
And like you mentioned, the kind of like a triage nurse.
Yeah,
I'm imagining.
so it's definitely widened. It's no longer just that one linear path that people perceive that if you're in nursing, you have to like become a registered nurse. It's starting to branch out a little bit from the people I've talked to.
Okay. And what about outside of Ryerson, at other academic institutions, how is nursing seen or classified? And is it a STEM course at other universities?
Just beyond like Ryerson, there is still this perception that nursing isn't a STEM field. Just beyond government institutions that classify school programs as STEM haven't done that either. Nursing has been largely absent from that as well, and some people want that to change.
Okay. And what about at George Brown? Because we have a collaborative nursing
Right.
program with them. What is their approach to nursing?
Those who do the collaborative program end up getting the bachelor degree.
Okay.
Those who do the 2-year program at George Brown, I believe, can get the diploma, which allows them to be a registered practitioner nurse.
Okay. And what would it get to essentially classify nursing as a STEM program? Who does that, and is it even possible?
There's no governing body that designates this is STEM, that's STEM, this is not STEM. It's kind of a conversation that's not being held right now, and I think that's what's needed in order to kind of push this forward.
And in terms of Ryerson's program as well, is it more care-based, or does it kind of cover enough scientific concepts that students actually feel engaged in that kind of respect?
Yeah, according to the people I interviewed, they definitely do think so. One of the person I interviewed, Stephanie, she actually got her Bachelor's of Science in Health Studies out of Waterloo,
Mm-hmm.
and now she's doing her 4-year program of nursing here at Ryerson. And what she told me was that a lot of the stuff that she learned there, either Ryerson goes further in depth or overlaps with, and she got a science degree. So she said that a lot of the stuff she's learning right now, it's pretty much stuff she's already learned in a regular science degree, or it's gone further in depth to what she's already known.
So it seems like there's kind of like a two-part problem here. There's a lack of precision on what exactly STEM is, or lack of definition, and then you have the existing bias that nurses are caregivers as opposed to scientists or the like kind of thing.
Right, and it was surprising to me as well when I first picked up the story. I kind of didn't think about it either. Like, I always assumed I knew what STEM was. But then this question came up to me, and that kind of shattered that worldview. And then when I tried searching into it, like when I tried finding a body or a higher institution that would give me the answer, that's just as hard to find. That there is no set definition of what constitutes as STEM, because at the end of the day, it comes down to the individual and what they believe is sciencey enough to be part of STEM. A lot of people are trying to change this perception because nursing students do go through a lot, and well beyond once they're done being students, they still do a lot once they're in the field. And some people believe that they deserve that recognition.
And yeah, we're almost nearing the end. Is there anything else you want to bring up or that should be spoken about this debate when it comes to nursing and STEM?
Yeah, I definitely think the big point that I've kind of seen from the investigation or the work research that I did is that there needs to be a bigger conversation. I feel like people have had this idea in their mind, not recently, but for a long time. Like, it's been a debate that needs to happen, or at least a conversation that needs to happen. And I think once that conversation happens, we can start moving the wheels to try and designate nursing as a STEM field. But I know that a lot of people have had opinions on this for a while now. It's just a matter of fact of speaking on them, I think.
Okay, and hopefully your piece will kind of spark that debate. That's all the time we have, so thank you for joining me today, Kosalan. To read the full feature on nursing and STEM, along with a variety of other science-centric pieces, be sure to pick up this week's edition of The Eye Opener on Stands Now. Thanks again.
Thank you.